Okay, this is Internist conversation number 12. So I was talking to this internist and he says to me, you know, you ought to make a playlist just for doctors to kind of get doctors up to speed. Because internal medicine doctors, they don't know this stuff. They don't know nutrition, epidemiology, toxicology. Right. And I say, okay, yeah, you know what? I'll make a playlist for doctors. Fine. Internist then says, I just had this patient with newly diagnosed AFib. It's really mild. I try to get him to try the low-fat vegan diet and he just ignores me. He goes to a cardiologist on his own and right away they pop a Watchman into him. A Watchman is a left atrial appendage blocker, you know, to prevent thrombus from forming, clot forming from the left atrial appendage that might embolize distally and cause a stroke. The guy could have probably been cured with just a low-fat vegan diet. It was really mild AFib. So, you know, they offered him basically go on anticoagulation or we'll put in a Watchman, you know, kind of like a left atrial appendage clip. Watchman's place transcatheter into the left atrial appendage. In comparison with open heart surgery, they'll just clip the left atrial appendage. But, you know, it's so stupid. Okay, they're going to have to do a transesophageal echo 3 times with anesthesiologists to, you know, check it pre, to intra-procedural, and then they're going to do a post-procedure check on it. You know, it could have been cured with a low-fat vegan diet. They're already talking to him about possibly doing an ablation. You know, this is a guy with mild AFib who I think could have been cured. Yeah, so patients are so stupid. They're not afraid of surgery. They love surgery, okay? They'll consent for any BS procedure right away. I remember, you know, I did a surgical internship. Guys will consent for craniotomy, open heart surgery, chemotherapy, you name it like that without even thinking. But you tell them to try a low-fat vegan diet and they freak out and say no. Internist, yeah. You know, let's see what else he said. I got a lady patient who thinks her gallbladder is causing her pain. She wants to go for surgery for a gallbladder. I said, why don't you try a low-fat vegan diet? It might resolve your symptoms. And she's like, oh, no, I don't want to do that. And I said, well, look, once you do, you take the gallbladder out, I'm going to recommend low-fat vegan diet again because you're going to have increased risk of colon cancer with all the bile salts dripping down into your colon because the gallbladder's out as a storage site. And she's like, well, I don't know if I want to do that. And he's like, it's going to be recommended for you post-op anyways, so why not do it pre-op and maybe cure yourself and not need surgery? She had like no significant fear of the surgery. Yeah, I know. She's better off with low-fat vegan. And, you know, why put yourself at risk for surgery? Most of the time, cholecystectomies go really well. They got a lot of experience doing them, the surgeons. But, you know, sometimes you'll have drop stones, form abscesses. I had to drain several abscesses for that. You know, some people, it's really rare, but sometimes the bile ducts are injured, common bile duct, or there's a variant anatomy, and they can have a hard time in there, end up with a bile leak. Internist, yeah, I got another guy on 3 meds, you know, for hypertension, and also he's fat. So I tell him he could probably lose all the weight and come off all his meds, or at least 2 of them, if he just try a low-fat vegan diet. And so he was not happy about that. He said he did not want to do that. The next day he calls the office and lets the secretary know he doesn't want me to be his doctor anymore. He says he doesn't agree with how I think about medicine, and he wants to go see one of the other doctors that'll just prescribe a pill. I said, yeah, it's so stupid. And it's like, you know, what are you going to do? You give this guy a chance to be cured, to save him from all the BS, all the accumulating pills and sickness and morbidity he's going to go through, and he refuses. It's like Voltaire when he said, it's difficult to free a fool from the chains he loves, or Proverbs, as a dog returns to its vomit, so a fool to his folly. You know, or Euripides when he said, speak sense to a fool and he calls you foolish.